Heart disease is the UK's second leading cause of death. Early detection is crucial. HeartFlow's AI-enabled technology provides non-invasive, accurate assessments, helping healthcare professionals diagnose heart conditions sooner for better outcomes.
Coronary heart disease is one of the UK's leading causes of death. Identifying problems early can not only improve the health of the patient, but also reduces the risk of future issues. Traditional tests to discover blockages have their limitations and can be invasive. HeartFlow's advanced artificial intelligence software using CT scans are helping doctors make accurate and effective diagnosis.
The difficulty for doctors is that there are lots of causes of chest pain and breathlessness, and they're not all due to coronary artery narrowing. So there's a whole variety of tests that doctors can choose. The CT scan focuses X-ray on the heart and can tell whether there are narrowings in the wall of the coronary arteries, and thereby tell us if there are fatty deposits. But you can't know for sure in most people whether those narrowings are restricting the blood supply and causing the symptom without more information. This is where we come to the HeartFlow FFRCT test. This test uniquely, via a very sophisticated computer modelling tool, which is now run using artificial intelligence, can not only see whether there are narrowings in the wall of the arteries, but also model whether the flow down those arteries is restricted. And it's very precise, so it can say one artery does have flow restriction and another doesn't. Now this provides doctors with, in my opinion, a unique new way of assessing patients.
For patients needing a stent to improve the blood flow, seeing their own heart and blockages helps better understand why they need a procedure and to relieve their fears. Sarah was 50 when her specialist, Dr. Hayworth, told her she had heart disease and would need an operation. It came as a shock.
It was all really quite surreal and it happened quite quickly. The pains that I started to experience became quite intense. It was really quite crushing, to the point that I'd be rocking and trying to breathe through it. So as they ramped up more and more, the more I started to think, okay, it looks like and feels like it could be something cardiac. But I didn't have the typical signs. I had no pain down my arm, I had no pain in my jaw. It was all central chest or behind my shoulder blades. So on the day of surgery, they explained to me on a tablet what my heart was doing, where the difficulties were, where the narrowing was. Since then, I've been very mindful about what I'm eating. I'm not a saint at all, but I'm just a bit more mindful about it. And obviously, I'm religious with my medication because I know my medication will keep me healthy as well.
Healthy life choices, eating habits, and exercise are incredibly important. But if something doesn't quite sit right, getting a second opinion can make it clearer.
I would say to anybody, if there's anything that's a little bit unusual or something that's come out of the blue, do check on it. And if you are given medication, make sure you take it. And I've got the energy back, absolutely.
Patients like Sarah are put at ease by being able to see how their heart is restricted and what steps the surgeon will take to fix it.
We'll meet them on the day, talk them through the procedure, show them, in fact, the 3D plan at that stage, if they haven't seen it before, to show them exactly what we're going to do. And the technology we have now is really exciting because we're starting to be able to identify plaque in the arteries and actually quantify that to measure how much there is. And using that measurement, we can work out an individual risk for the patients, which we haven't been able to do before from CT scans. So, for instance, some of the analysis on Sarah's scan suggested she was in a very high-risk group because of the amount of plaque she had in her artery at the particular point that we went on to put a stent in. And of course, you tailor it individually to your patient. And I think that can only be better for people going forward, that we can individualise their treatment based on their anatomy and their arteries.
Using HeartFlow's AI technology alongside the CT scan helps doctors get a greater understanding of the heart, helping patients now and possibly preventing heart disease in the future.